made simple.
Now there's a new survey out today and it suggests most parents are more likely to ask their parents for advice about their children's teeth than a dentist.
Well, we have someone here trying to ease those fears about getting your teeth checked. Here is Dr. Milad Shadru. He's also known as the singing dentist, and this is why.
The dentist isn't your favorite place, and I know you don't want to go. Me and my nurse sitting here, we're wondering why you hate us so.
I mean, I don't know about the singing, but that is a good eyebrow game. Here we have the singing dentist, Dr. Milad Shadru.
Good morning.
I mean, you are a YouTube sensation with that, and it's all about encouraging people to go to the dentist and not be frightened. I mean, you don't look particularly frightening there.
Thank you. Yes, that's the whole point, just to get people talking about teeth, and if that fails, just hypnotise them with the eyebrows. You know?
I can't quite remember when I first took my kids to the dentist, but they certainly weren't babies. It was probably after all their teeth had come out. But you're saying that we need to go earlier?
Absolutely, yeah. So there is a lot of confused mums out there. So the survey, the Brush Baby survey that came out showed that 72% of mums aren't getting any messaging at all about what they should do with their baby's teeth. And the whole journey, and it is a habit that we have to establish. So if we can start that journey from young, then it's going to hopefully stay with the generation as they grow, and it'll become a normal thing to go. And waiting until all the teeth are there, by that point it could be too late.
What I didn't realise is about looking after your baby's gums as well, because you don't think until teeth arrive, then all of a sudden you associate teeth with a dentist. So, you know, how much they look after their baby's gums?
Absolutely. So wiping the gums, it can help to prevent the bacterial build-up still in babies' mouths, and it gets them used to having their gums touched. And, you know, I've got a 3-year-old and a 1-year-old, and if we weren't doing those things, I hear the stories all the time that kids just won't let a toothbrush go anywhere near them. But that's because they're not used to having that sensation in their mouth. So if you're doing it from a young age, and also during teething, you know, kids will want to bite on stuff and chew on things because the pressure on the gum helps to alleviate some of that pain. So if they're already used to that sensation, it just helps.
It's hard to even get in a baby's mouth to check how many teeth they've got growing, let alone put a toothbrush in there.
Does it actually matter to take your children to the dentist? I remember taking Amelia when she was maybe 4, when she was about to start school, and she did need a filling. But the point is, milk teeth fall out. So does it actually matter? Because they're all going to go anyway.
That's something we hear again all the time. It does matter because we want baby teeth to fall out when they are supposed to fall out, when the adult teeth are ready underneath to kind of push them out, and it's pain, you know. Getting a hole in the baby tooth still hurts a lot, and children suffer. Losing teeth early can cause lots of problems later on. Their eating is affected, their speech development can be affected, so there's lots of reasons.
But also, you don't always lose all your milk teeth. I've still got milk teeth here where there were no big ones to force them out.
Yeah, exactly. Yeah. And if the oral hygiene wasn't good, then those baby teeth wouldn't have been able to last, you know, into young adulthood, let alone till now.
Oh, very interesting indeed. OK, Dr. Milad Shadru, the singing dentist.
A bit more of the eyebrows. Could you do a bit of eyebrow action?
Yeah, I mean, that's a strong eyebrow game. Really good. Jackie, follow that. Follow the dancing eyebrows.
I'd love to be able to, but I can't.